Good morning, afternoon, or evening, wherever you may be around the world watching Rwanda television. It's time for the news. My name is Serge Nhore. We'll start with the headlines. President Paul Kagame has chaired Rwanda's final cabinet meeting for the year 2025. The findings of Rwanda's 7th Demographic and Health Survey have been made public. I'm glad you're able to join us. Now, as we begin this edition of the news, let us first read to you the following communiqué that has been issued from the Office of the Prime Minister. On Wednesday, the 17th of December 2025, His Excellency Paul Kagame, the President of the Republic of Rwanda, chaired a cabinet meeting at Village Urugwiro. The cabinet was briefed on the 4th of December 2025 signing of the Washington Accords for Peace and Prosperity between Rwanda and the Democratic Republic of Congo. The cabinet reaffirmed Rwanda's commitment to full implementation of the Washington Accords, support of the Doha process, and continued engagement in the United States facilitated mediation grounded in a balanced approach that takes into account security concerns of all the parties. The cabinet was briefed on the 7th Demographic and Health Survey, which shows significant improvement in key outcome indicators. The cabinet is committed to invest in efforts to sustain and expand further access to quality health services for Rwandans. The cabinet was briefed on the progress of the agricultural season 2026A, noting efforts to maximize crop yields, post-harvest preparedness, and market linkages. The cabinet approved applications for Rwandan nationality. The cabinet granted agreement to proposed diplomats representing countries and international organizations as follows. Ms. Nasra bin Salim bin Mohammed Al Hashmi, Ambassador Extraordinaire and Plenipotentiary of the Sultanate of Oman to the Republic of Rwanda with residence in Nairobi, the Republic of Kenya. Mr. Balibov Sadikov, Ambassador Extraordinary and Plenipotentiary of the Republic of Kazakhstan to the Republic of Rwanda with residence in Nairobi, Republic of Kenya. And Dr. Richard Ameya, representative of the Joint United Nations Program on HIV/AIDS or UNAIDS to the Republic of Rwanda, head of the UNAIDS Multi-Country Office with residence in Nairobi, Republic of Kenya. The cabinet approved the following appointments. For Wasak Group Limited, members of the Board of Directors, Mr. Cho Men Yong, the Chair, Ms. Dederi Wimana, Vice Chair, Dr. Jean-Pierre Shimimana, Member, Mr. Albert Munyabugingo, Member, Ms. Juliet Kavaruganda, Member, Ms. Gema Maniraruta, Member, and Ms. Juliet Gakwerere, Member. For Wasak Utility Limited, Mr. Maxime Marius Mwiseneza has been appointed the Managing Director. This communiqué is dated the 17th of December 2025 and has been signed by Dr. Justin Nsengiyumva, the Prime Minister of Rwanda. Now, the Ministry of Health says it will step up efforts to address challenges highlighted in the 7th Demographic and Health Survey, including teenage pregnancies that result in young mothers raising children who are at higher risk of malnutrition and stunting. We have the details with William Evans Mutabazi.
A 17-year-old girl we met in the city of Kigali is among the 22,454 teenagers who became pregnant last year. According to the 7th Demographic and Health Survey, this is a challenge faced by 8 out of every 100 teenage girls.
In efforts of looking for what to feed my child, I sell avocados. Sometimes the only option you have is accept it the way it is. My advice to young girls is to be careful not to get pregnant. They should wait until they are of the right age. Unplanned pregnancies are not good.
The survey also indicates that child stunting remains a concern, standing at over 30% in 11 districts, with Gicumbi, Burera and Ngororero recording the highest levels. The western and the northern provinces lead other regions in the number of districts affected by stunting. The Minister of Health, Dr. Saben Sanzimana, says the government will focus more efforts on areas where weaknesses are most pronounced, including stunting, which is linked to several other challenges.
The numbers look very interesting and good in many ways, maybe 90% positive. But there are three indicators that, to me, need more reflections and probably guiding our next planning and strategy as we start a new year. It's actually one trend. It's one single set of indicators that are into one box. Teenage pregnancy, neonatal mortality, and stunting. These three are connected. For those who are in the sector, you may see how they are interlinked. So what NISR just presented to us is a confirmation of what we've been seeing from our day-to-day work within our sector. For us, it's an area of focus.
The United Nations resident coordinator in Rwanda says it's vital to have a healthy population, as healthy citizens are able to work and contribute productively to national development.
This is important because when you have a healthy population, you have a healthy workforce. So when you have a healthy workforce, then the productive capacities in societies are enhanced, which has a direct implication on the economy. Most importantly, also in terms of the decline in fertility rates, what it does help us recognize is the possibility for family savings. Because when the numbers are small, the parents are able to conserve their resources. They're able to invest better in the social well-being, in the health, in the education of their children. So you have better education children. And we saw from the statistics on teenage pregnancy, the factor.
The 7th Demographic and Health Survey shows that children stunting has declined to 27% from 33% in 2020, representing a 6% point reduction over 5 years. However, the rate of teenage pregnancy has increased by 3% points, rising from 5% in 2020 to 8% today. William Evans, RwandaTV News.
Thank you, William. Now, as we noted, Rwanda has continued to register steady progress in key health and well-being indicators, according to the findings of the 7th Rwanda Demographic and Health Survey that was released today. While the country has recorded significant gains in child nutrition, maternal health, and immunization coverage, authorities have acknowledged that challenges, particularly in teen pregnancies, do require urgent attention. Now, Adam Squizera with more on that.
The latest findings from Rwanda Demographic and Health Survey 7 paint a picture of progress in Rwanda's health sector, especially in child and maternal health outcomes. Stunting among children affected by malnutrition has reduced by 6%, now standing at 27%. The number of districts recording stunting levels above 30% has also dropped significantly from 28 districts 5 years ago to 11 today. The Minister of Health, Dr. Saben Sanzimana, says despite these gains, challenges remain in nutrition, non-communicable diseases, and teenage pregnancies, stressing that the government is strengthening prevention, community-based interventions, and access to quality healthcare services to address these concerns.
If you go into the data we have within the sector, those young mothers who are 15, 16, 17, they are most likely to have maternal mortality, more neonatal mortality. And the third indicator that I want to connect to this is stunting. And again, these three are connected. It's actually one trend. It's one single set of indicators that are into one box. Teenage pregnancy, neonatal mortality, and stunting. These three are connected. For those who are in the sector, you may see how they are interlinked. So what NISR just presented to us is a confirmation of what we've been seeing from our day-to-day work within our sector. So what do? We have a plan, we are implementing, but we need to move faster and to be more creative and innovative.
Maternal health indicators also shows marked improvement. Nearly 98% of mothers now deliver in health facilities, a factor that has contributed to the reduction of neonatal mortality from 45 to 36 deaths per 1,000 live births. Maternal mortality has similarly declined, dropping from 203 to 149 deaths per 100,000 live births, reflecting improved access to skilled care before, during, and after childbirth. Usonia Ojelo, UN resident coordinator, highlights how development partners continue to support Rwanda in closing remaining gaps.
This is important because when you have a healthy population, you have a healthy workforce. So when you have a healthy workforce, then the productive capacities in societies are enhanced, which has a direct implication on the economy. Most importantly, also in terms of the decline in fertility rates, what it does help us recognize is the possibility for family savings. Because when the numbers are small, the parents are able to conserve their resources. They're able to invest better in the social well-being, in the health, in the education of their children. So you have better education children. And we saw from the statistics on teenage pregnancy the factor of education. So better educated children means a better qualified workforce that speaks to Rwanda's aspiration for upper middle income country by 2050.
Immunization coverage now stands at an impressive 94%, reinforcing Rwanda's strong primary health care system. Minister of Finance and Economic Planning, Yusuf Murangwa, noted that these findings will define country's key priorities to be taken care of.
And this calls for renewed focus in terms of our interventions. These findings will help us refine our national priorities and ensure that resources are targeted and reach underserved populations, especially with equity across all regions. We will continue to emphasize very strong coordination across all sectors to get good results in health and demography. We need quite good coordination to see the results that we want to see that are targeted, and also increased efficiency in spending, especially at this moment. I call upon all multi-sectoral stakeholders to use these results to inform their programs and guide the investments that we put in health. Overall, we, the government of Rwanda, working with our partners, need to increase investments to sustain and accelerate these improvements.
However, the survey also reveals the growing concern of teenage pregnancies that have increased from 5% to 8%, prompting renewed calls for stronger reproductive health education and youth-friendly services.
Thank you, Adams. Now, the Ministry of Health says that the installation of modern equipment in neonatal care units across hospitals has reduced deaths among premature babies and those born with low birth weight. Parents have praised the government of Rwanda for the services, noting that their children are closely monitored by medical professionals and treated under health insurance schemes that do include Mutuelle de Santé. The government of Rwanda aims to reduce maternal and child mortality by 50% come 2050. The Ministry of Health reports that 45% of children who die before the age of 5 were born prematurely. Now, non-governmental organizations are reporting that the decentralization policy of Rwanda, which brings together leadership and decision-making, closer to citizens, has yielded visible results over the past 25 years. This was highlighted during discussions that brought together various government institutions and civil society organizations to assess the progress made under this policy and to exchange ideas on how to address remaining challenges that continue to hinder service delivery to citizens through decentralized structures. It was noted that under the government's 5-year program to accelerate development, the state plans to further strengthen decentralized governance so that by 2029, citizens will be satisfied with the services they receive at a rate exceeding 90%. Now, the Ministry of Trade and Industry says it is ready to support women entrepreneurs to increase productivity and ensure their products meet quality standards that can compete on international markets. William Evans Mutabazi with more on that.
The remarks were made during a trade exhibition bringing together Rwandan women entrepreneurs and their counterparts from Ethiopia. Held for the very first time, the exhibition aims to promote business partnership and the exchange of commercial knowledge. Gloria Kamanzu-Wizera, representing the African Women Entrepreneurs Program, and Dr. Nigest Hayele, who leads the Ethiopian delegation, said both sides stand to gain significantly from this collaboration.
We want our women of the two countries to work together. We want to introduce them to things that they can learn from each other. For example, I can say that Ethiopia is very known of its leather, and they are very advanced. So, for example, we got to know that our women need more knowledge on leather, how to make the accessories. And as you know, we have not started preparing our own leather. It's on the process where we export and we buy it again. We import, so which makes it more costly. So it will be very, very helpful to have these women learning from each other, our women in the leather sector to learn from the Ethiopian women exporters in the leather who already have the experience and the knowledge to deal with the international market.
Ethiopian Airlines having passenger flights 3 times a day and 5 times cargo a week. We have been observing that as a great opportunity that we can do business among our two countries, and we can take our bilateral trade volume to the next level while our women are starting to do business together.
The Ethiopian ambassador to Rwanda, His Excellency Masfin Gebrimariam Shao, said Ethiopia has identified products that Rwanda currently imports from various countries and believes Ethiopian industries can supply them at more affordable prices.
We have seen some of the textile products that produced here in Rwanda, they are importing from other countries, and we have had, we talked to those who produce that. There is a possibility that we can supply some of the materials from Ethiopia so that we can complement and bring the product to the market.
The Minister of Trade and Industry, Honorable Prudence Sebahizi, reaffirmed the government's commitment to supporting women entrepreneurs to boost production and access markets with high-quality products.
I
can say that the numbers are still very low. What we need to do is to support them so they can increase their production and be able to satisfy all our markets across Africa and beyond. At the exhibition, Rwandan women entrepreneurs expressed satisfaction with the experience they have gained in international trade. Through cooperatives in Rwanda, they say they've received skills and training to properly process their products and ensure they reach markets in competitive conditions. William Evans, RwandaTV News.
Martina Avera will be with you for the next edition of the news, so I hope you'll join her as well. I'm glad you did join me for this one, and I'll see you soon. Goodbye.